Dr. Elaine Val is back answering your dentist-related questions. All right, so doctor, the question is it okay to eat sugar-free candy during the day, or is it just as bad as eating sugar candy all during the day?
When it comes to preventing cavities, sugar-free candy is okay. Again, moderation, but that it has to do a little bit more with your stomach health than your teeth. Lots of sugar-free candies, they taste great, but they can definitely irritate your stomach and colon. But yes, sugar-free candy is allowed and it can be a delicious treat.
Okay. Most toothpastes are mint flavored. Is there something about mint that's good for your teeth, or is it just a breath benefit?
Um, I think mint is just universally accepted. Um, I personally love cinnamon toothpaste. I think it just feels a little fresher. I love the flavor of it. However, a percentage of the population gets terrible sensitivities to cinnamon. So I think that's why that one hasn't been as widely marketed. I think it's just the fact that it's really pleasing to most people. But no, you can pick any flavor you want.
Okay. What is the best toothpaste this person is asking? They say they use Crest.
Crest is a wonderful brand. There are lots of good products in the market, easy to look for ADA seal of approval. I always tell my patients whichever flavor you like best is really the best toothpaste for you because you need to keep it in your mouth for 2 minutes. And that's much easier if you find the flavor pleasant than if it's something that's off putting. For example, if you don't like the flavor of baking soda.
Uh-huh, gotcha. So this person is asking a question with something that I've never heard of before. What advice do you have for patients with large tori? What is tori?
Tori are just a variation of normal. There's nothing pathological about it, but some people get a little bit larger bone growth either on the gum side of their lower jaw or on the floor of their mouth, and it's absolutely okay. There's only two reasons we get worried about tori. In extreme cases, they'll kind of cover the floor of your mouth, and it can cause a little bit of a speech impediment. So in those cases, you can have them removed. The other reason, and we try to avoid this, but in the case where people need dentures, often you have to have those tori removed to make a well-fitting denture.
Hmm.
But in most cases, people have this and they don't realize it's any different than another individual, even in their family, but it's just normal, healthy bone growth, a little bit outside of the average.
Okay. This next question is, I've heard that dental health and heart health are connected. Can you tell me about this?
Oh, this is huge. And this is the reason some individuals need antibiotics before cleanings when they have certain heart conditions like bacterial endocarditis, which is an infection of the heart. The, th- we, the mouth is the gateway to everything. So keeping your mouth healthy will help prevent bacteria from getting into your bloodstream. And bacteria that gets in your bloodstream, of course, is going to travel through the heart. So there are, for individuals who are about to undergo heart stents or different treatments, it's very important to have your mouth as healthy as possible before you go through those procedures. And it's very important if you're at high risk for heart disease or other problems that you keep your mouth as healthy as possible to reduce bacteria that can naturally live around the gums from entering the bloodstream.
But it's not just the heart, right? Very often the dentist or the dental hygienist will have you in the chair and they say that they're looking in your mouth for signs of other things that could be wrong in your body. Like what?
Oh, oh my goodness. Love, love, love this question because again, you're having a healthy mouth is going to help keep your body healthy and vice versa. A couple things. Individuals who are prone to gum disease or periodontal disease, that will be absolutely intricately linked to diabetes. So someone with uncontrolled blood sugars can lead to a spike in the dishealth of their gums and vice versa. If you have unhealthy gum tissues and you're a brittle diabetic, that absolutely can affect your blood sugars. So that's one. There's a good link between untreated gum disease and higher risk for Alzheimer's. Um, Absolutely, infection of the gums can be a risk factor for low birth weight, and individuals who are pregnant can have certain conditions that will inflame the gum tissue. So I know dentists are their own different office. We see them outside of the Novants or atriums, but absolutely your mouth is very much linked to your overall health.
The fact that you could be getting your teeth cleaned and someone could tell you that you may also have something else that is wrong with you that has nothing to do really with your teeth is really interesting. Okay, we're going to take a quick break. We're going to check in with the forecast, and then we're coming back with the last segment of your questions.